my name is Megan Byrne and this is my Unit 14 presentation, Pregnancy and Health, which is health science. So gestational diabetes, also known as GD, occurs when hormonal changes during pregnancy reduce the body's ability to use insulin effectively, resulting in high blood glucose levels. Several factors increase the likelihood of developing this condition. Common risk factors include being overweight or obese before pregnancy, a family history of diabetes, particularly type 2 diabetes, previous gestational diabetes in an earlier pregnancy, previous birth to a larger baby, over 8 pounds, maternal age being over 25 to 30 years old. Certain ethnic backgrounds have a higher risk also, such as South Asian, African, Caribbean and Middle Eastern, and conditions affecting insulin regulation, such as polycystic ovary syndrome or PCOS. However, gestational diabetes can still develop in individuals with no obvious risk factors, which is why routine screening is really important during pregnancy. Gestational diabetes is usually diagnosed through screening tests carried out during pregnancy, most commonly between 24 and 28 weeks of gestation. The main diagnostic test is the oral glucose tolerance test, or OGTT. During this test, the pregnant person will fast overnight. A fasting blood glucose level is measured, and they then drink a glucose solution containing a measured amount of sugar. Blood glucose levels are measured again after a set period, which is usually 1 to 2 hours. If the blood glucose levels are higher than normal, gestational diabetes is diagnosed. Many individuals experience no noticeable symptoms, which is why screening is routine for all pregnancies. However, possible symptoms can include increased thirst, frequent urination, fatigue, recurrent infections such as thrush, increased sugar levels detected in urine during antenatal tests. Because these symptoms can also occur in a normal pregnancy, blood testing is required for confirmation. The care plan. So the aim of treatment is to maintain normal blood glucose levels to protect both the baby and the pregnant person from complications. A typical care plan may include blood glucose monitoring, which is just regular monitoring using a finger prick blood glucose meter, usually tested several times per day, including fasting levels and after meals. Dietary management, which is a balanced diet with controlled carbohydrate intake, preference of low glycemic index foods to avoid rapid spikes in blood glucose, and smaller, more frequent meals may be recommended. And there'll be guidance from a dietitian or diabetes specialist also. Physical activity, so moderate exercise such as walking or swimming if medically safe. Physical activity helps improve insulin sensitivity and control blood glucose levels. Medication if needed, so metformin may be prescribed to improve insulin sensitivity. Some individuals may require insulin injections to regulate their blood glucose. Increased monitoring during pregnancy, so more frequent antenatal appointments, regular ultrasound scans to monitor fetal growth and amniotic fluid levels. And birth and post-pregnancy care. Labour may be induced before the due date if complications arise. Blood glucose levels are usually checked after birth because gestational diabetes often resolves. And individuals are advised to maintain healthy lifestyle habits due to an increased future risk of type 2 diabetes. So, preeclampsia. Preeclampsia is a pregnancy complication characterised by high blood pressure and signs of organ dysfunction, usually developing after 20 weeks of pregnancy. Although the exact cause is not fully understood, several factors increase the likelihood of developing the condition. Common risk factors include if it's your first pregnancy, there's a previous history of preeclampsia in an earlier pregnancy, family history of preeclampsia, they normally look at your mother or your sister, multiple pregnancies, so twins or more, pre-existing high blood pressure such as chronic hypertension, pre-existing diabetes including type 1 or type 2, kidney disease, autoimmune conditions, maternal age over 40 years old, and obesity or high body mass index. These factors can affect placental development and maternal blood vessels, increasing the risk of abnormal blood pressure and reduced blood flow to the placenta. Signs and symptoms of preeclampsia. So less common signs or symptoms are things like nausea or vomiting later in the pregnancy, sudden rapid weight gain due to fluid retention, shortness of breath caused by fluid in the lungs, reduced urine output, or feeling generally unwell or confused. Because symptoms can sometimes be mild or develop gradually, regular monitoring during antenatal appointments is essential for early detection. More common signs or symptoms include high blood pressure, protein in the urine, severe or persistent headaches, swelling, also known as edema, of the face, hands or feet, visual disturbances such as blurred vision, and pain below the ribs, particularly on the right side. So the care plan for monitoring and managing preeclampsia is that management focuses on protecting the health of both the pregnant person and the baby while preventing the condition from worsening. Regular monitoring of things such as frequent blood pressure tests, regular urine testing for protein, and blood tests to assess kidney function, liver function, and platelet levels. Fetal monitoring, such as ultrasound scans to check growth and amniotic fluid levels, Doppler ultrasound to assess blood flow through the placenta, and cardiotocography, or also known as CTG, to monitor the baby's heart rate. Medication, if blood pressure comes elevated. So there's medications that may be prescribed to help reduce blood pressure, or in more severe cases, magnesium sulfate may be given to reduce the risk of seizures. Lifestyle and rest, so reduced physical activity or bed rest in some cases, close observation either at home or hospital depending on severity, and the planning on the birth. So the only definitive treatment for preeclampsia is delivery of the baby and the placenta. If the condition becomes severe or the baby is at risk, an early induction of labour or caesarean birth may be necessary. So eclampsia and potential complications. So eclampsia is a severe and life-threatening complication of preeclampsia. It occurs when a pregnant person with preeclampsia develops seizures that cannot be explained by any other neurological condition. If preeclampsia is not properly managed, several serious complications may develop. So these include seizures or eclampsia, stroke or brain hemorrhage, liver damage or rupture, kidney failure, a severe condition called HELLP syndrome, which is hemolysis, elevated liver enzymes, and low platelets. So potential fetal complications include restricted fetal growth due to reduced placental blood flow, premature birth, placental abruption, which is when the placenta separates from the uterus too early, or a stillbirth in severe and untreated cases. Early diagnosis, careful monitoring, and timely medical intervention significantly reduce the risks for both the baby and the mother. Alcohol and pregnancy. Alcohol consumption during pregnancy can have serious effects on both the pregnant person and the developing baby. Alcohol passes easily through the placenta, meaning the embryo or fetus is exposed to similar alcohol levels as the pregnant person. Because the fetal liver is not fully developed, it cannot process alcohol effectively, which can interfere with normal development. Exposure to alcohol in the womb can lead to a group of conditions known as fetal alcohol spectrum disorders, or FASD. The most severe form is fetal alcohol syndrome. Risks to the developing embryo or fetus, if exposed to alcohol during pregnancy, can cause brain damage and impaired neurological development, learning disabilities and behavioural problems, poor growth before and after birth, characteristic facial abnormalities associated with fetal alcohol syndrome, heart defects and other organ abnormalities, increased risk of miscarriage, premature birth or stillbirth. The effects may vary depending on the amount of alcohol consumed. the timing during pregnancy, and the individual biological factors, but no safe level of alcohol consumption during pregnancy has ever been established. So the risks to the pregnant person is, although the most significant harm is to the baby, alcohol use during pregnancy can also increase the likelihood of poor nutrition and vitamin deficiencies, contribute to mental health difficulties or alcohol dependence, increase the risk of pregnancy complications and poor antenatal outcomes. And for these reasons, public health guidance recommends complete avoidance of alcohol during the pregnancy. So, use of illegal drugs during pregnancy. The use of illegal drugs during pregnancy can significantly affect the baby's health both before and after birth. Many drugs cross the placenta and directly affect the developing fetus, potentially altering brain development, growth, and organ function. Common substances associated with pregnancy complications include cocaine, heroin, methamphetamine, and cannabis. So, babies exposed to drugs in the womb may experience withdrawal syndromes after birth, known as neonatal abstinence syndrome, or NAS. Symptoms can include excessive crying and irritability, tremors or seizures, feeding difficulties, vomiting or diarrhea, or poor sleep patterns. Oh, and breathing problems. These babies often require specialist neonatal care and monitoring. Longer developmental impacts, so exposure to illegal substances during pregnancy, can also affect the child's long-term health and development. Potential outcomes include low birth weight and slower physical growth, delayed cognitive development, learning difficulties, behavioural problems such as hyperactivity and poor attention, increased risk of emotional and mental health difficulties later in childhood. Some children may also experience social and environmental challenges, particularly if parental substance misuse continues after birth. Illegal drug use during pregnancy can have a lasting biological, neurological, and developmental consequence for the baby. Early intervention, medical care, and support services for both the parent and child can help reduce long-term harm and improve developmental outcomes. And that's the end. Thank you very much.